Do you know that most of the debilitating diseases like autoimmune disease, example Hashimoto's disease and rheumatoid arthritis, has a significant link to the gut health? Number one is stress. Daily worries, taking care of people, preparing for exam, worrying about financial difficulties or anything, or spiritual battles and all those stuff. You can induce leaky gut and dysbiosis in this state of negative environment or negative ambiance.
And there are microbial communities everywhere, like in the soil, in the ocean. But for physicians and patients, the one that we kind of focus on are the microbiota, the microbial communities that exist in and on us, because they have the power to shape our health and well-being.
Second, common medications like NSAIDs or non-steroidal anti-inflammatory drugs, which paradoxically is a main treatment of rheumatoid arthritis to control the pain. This is almost like treating with a band-aid, not looking into the specific cause of the disease, which is in the gut. Antacids, for example, very common. You give NSAIDs and it affects the gut. What the doctor would give would be antacid, like H2 inhibitors, or like Pepcid or ranitidine or Zantac, or the worst would be the PPI or the proton pump inhibitor like Prilosec. And poor patients, when they go home from an episode of gastric bleeding or something, or gastritis, doctors would continue to give these medications, not knowing that these can be harmful for the probiome and therefore aggravate the underlying mechanism of disease. Let's talk about the main treatment, non-steroidal anti-inflammatory drugs. Ibuprofen, meloxicam, naproxen.
Are you taking pain medication? A category of painkillers known as NSAIDs, which stand for non-steroidal anti-inflammatory drugs, damage the lining of your intestinal wall. They work by stopping the production of chemicals in your body called prostaglandins, which promote inflammation, pain, and fever by blocking COX enzyme.
The main side effect, which can be deadly, gastric ulcer, which can bleed, duodenal ulcer, which can bleed. It also decreases the platelets aggregation, which can predispose you to bleeding. So why would you treat patients like that? Second on the list would be the disease-modifying drugs. For example, methotrexate. It's given once a week at a low dose. It's supposed to decrease the immune function, and you are predisposed to common bacterial infection or viral infection. Not only that, methotrexate in itself, when you have rheumatoid nodules, usually rheumatoid nodules is not from the disease in itself, but it's actually aggravated and produced when you are taking methotrexate. So why take it? The antimalarials, the chloroquine or Plaquenil, it's supposed to decrease the lysosomal activity and the degradation of prevents phagocytosis and autophagy, which is common in the process of developing rheumatoid arthritis symptoms. It causes retinopathy, sometimes blindness. That's Plaquenil. That is to treat rheumatoid arthritis. And patients are predisposed to bacterial infection, which can be deadly, like pneumonia, bacteremia, viral and fungal infection, especially in the lung and in the whole system. Last but not the least is steroid, prednisone. It's prescribed everywhere. I was so frustrated the other day. My patient had back pain, treatment, prednisone, methylprednisone, and muscle relaxant. I'm being tangential, but I mock steroids. The gut is a center of health. There's a gut immune brain connection. How can you destroy this microbiome? And how can you induce leaky gut? It starts like this. The micronutrients, like the vitamins, trace minerals, which is essential for your wellness and immune function, thrives. So if this is disrupted, this can create havoc in your health. Together with this is your probiome, which is about 30 trillion in species. Now, if you disrupt this can create imbalance or dysbiosis. If there's an overgrowth, or what you call the SIBO, or small intestinal bacterial overgrowth, meaning the bad bacteria overgrows the good bacteria. Let's say, for example, this phenomenon. If there's an increased population of Collinsella in the gut, a type of bacteria, it's a bad bacteria. It reduces the expression of tight junction in the protein in the gut. That's what you call leaky gut. So it destroys the mucin layer. It increases gut permeability, Collinsella. It releases pro-inflammatory cytokines like interleukin-1, interleukin-6, and this creates inflammation. And remember, all these diseases we're talking about, autoimmune disease, especially rheumatoid arthritis, the endpoint of the cascade is inflammation. And it manifests with pain, swelling in your joints. Eggerichella, for example, the second bacteria, when the population is increased or it overflows, it converts arginine residues of protein to citrulline residues. Citrulline residues. These are the residues that dwells in the joints that causes inflammation in rheumatoid arthritis. It increases citrullinization of proteins in the gut. So it creates more inflammation and creates more symptoms, painful symptoms. Prevotella, for example, another well-studied organism, the species, especially Prevotella copri, which dwells in your stomach.
But this particular bacteria is normally found in your gut microbiome. The flora, the bacteria, fungal species, virome that lives in the gut. And it has been shown in research to be at higher levels, which we might call an overgrowth, in people with newly diagnosed rheumatoid arthritis.
Is responsible for polysaccharide breakdown. Prevotella copri acts against the immune responses to T cells. It stimulates secretions of inflammatory substances like interleukin-1b, interleukin-6, interleukin-17, and interleukin-23. In the end, it causes inflammation, and it seemed to be one of the causes of developing rheumatoid arthritis. So in essence, Prevotella, which is also in the gut, cannot be allowed to overgrow or to become a SIBO. What about Porphyromonas gingivalis, gingiva, which is dwelling in your mouth? When it overgrows, it increases with the concomitant growth of the other organism that I mentioned, and this migrates to the synovial tissue that creates inflammation of rheumatoid arthritis. And it also causes citrullination of proteins in the synovial tissue, which is one of the hallmark of rheumatoid arthritis. The good bacteria, in essence, as I said, is an important creation of God. It's embedded in your intestine. All you need to do is to flourish it. How? Bacteria needs short-chain fatty acids and many more.
And while we can't control all these factors, we can manipulate the balance of our microbes by paying attention to what we eat. Dietary fiber from foods like fruits, vegetables, nuts, legumes, and whole grains is the best fuel for gut bacteria. When bacteria digest fiber, they produce short-chain fatty acids that nourish the gut barrier, improve immune function, and can help prevent inflammation, which reduces the risk of cancer. And the more fiber you ingest, the more fiber-digesting bacteria colonize your gut.
But how do you produce short-chain fatty acids? It is through fermentation of fiber. Yes, fiber. Not processed carbohydrates, not processed or liquid sugar, but the fiber from the fruits, from the vegetables, the whole fruit, everything that was endowed to you by nature. If you want to keep the temple of God healthy, because we are called to protect the temple of God, the Holy Spirit, which is our body, we have to follow these things. Respect the nature, respect the law of nature in the body, the probiome. Do not kill them, because this microbacterium, the good bacterium, is essential for your health. Number one, this bacteria produces substances, in essence, also heals the leaky gut. Second, it transmits some substances, for example, that enhances metabolism. That's why there are some bacteria that if it's decreased in your system or in your gut, you will be predisposed to obesity, because you're not able to metabolize properly. There is some bacteria that also produces the substance called serotonin or neurotransmitter. Remember, serotonin is produced in the gut, now about 90%, not in the brain. So there are bacteria that also, if it's decreased in population, you will be predisposed to mental illness like depression or anxiety. Circle back, this phenomenon of mental conditions, anxiety, depression, can also decrease the population of the good bacteria by switching the normal tone of part of the autonomic nervous system from parasympathetic to sympathetic. You're fight and flight all the time.
By stimulating the vagus nerve, we believe that we can downregulate the increased expression of these inflammatory cytokines, and thus downregulating the immune system.
Because this also gives you the cascade of the hypothalamic pituitary axis, which is deleterious to your health. All these things are connected. And also lactobacillus, the good bacteria, the good lactobacillus, which is your friend, reduces the growth of Bacteroides, E. coli, and Shigella in the gut. Now, these three enteric organisms is responsible also, especially the E. coli, is responsible for the new trend of early onset colon cancer. Well, it used to be colon cancer is usually starts around 50, 60 years old. But there are many of us now are affected with this early onset colon cancer because of the overgrowth of this enteric organism. This is basically when you have diarrhea when you're young and the E. coli did not get pacified, it overgrows and it causes this mutation of the DNA in your colon and cause colon cancer. Let's talk about the mechanism of leaky gut. In a normal state, the intestine is covered by mucin, a protective layer that prevents antigens or foreign bodies that goes to the system and get seen by the immune kingdom. And let's talk about the lymphocytes. The lymphocytes produces antibody, the B lymphocytes for the bacteria, T lymphocytes for the tumor cells, virus and fungus. And there's another type of lymphocyte called natural killer cells, which does not produce antibody, but is very important for your immune system because its sole action is to scavenge those foreign bodies like bacteria that gets into the blood and just phagocytose them, which is to scavenge them and put them in the endothelial system where they are killed, banished, gone. But if your immune system is not intact, is not healthy, you have a problem. Together with this, the leaky gut also, concomitant phenomenon will be the dysbiosis. There will be overflow of bad bacteria. And specifically for the things that we're talking about, sugar decreases the population of your bacteria. For example, when I make a fermented bacteria with milk, if you add sugar, it will not ferment well. I'll give you a tip. Fermenting bacteria, not just by yogurt making, but fermenting bacteria to billions of bacteria has shown to decrease the symptoms of rheumatoid arthritis and has shown to improve health, including psoriasis and other autoimmune disease. Stay away from sugar because it's inflammatory. It kills your microbiome. It also increases your triglyceride, your small LDL, which predisposes you to cardiovascular disease. And in itself, rheumatoid arthritis patients are predisposed to cardiovascular disease. I'm talking about heart attack because you have a lot of inflammation. So do not feed yourself. Do not poison the temple of the Holy Spirit with sugar. Remedy: fast from sugar and fast intermittently. If you have questions, ask me. Make a comment about this. Exercise. Exercise consumes sugar. It also decreases inflammation. It decreases your cortisol level, which in effect will decrease the sympathetic tone, which is inflammatory, make it as a form of corporal mortification. One step. Because when you exercise, BDNF increases, which motivates you neurophysiologically to exercise. Increase the level, transcendental meaning of exercise. Next would be oral hygiene. The first thing that you do is to brush your teeth to eliminate the overgrowth of Prevotella, for example.
Well, this, just out in the Archives of Oral Biology in 2014, shows us two things that are really astonishing to me. Number one, this I did not know, so keep learning. You find something out every day. But the number one stress-related hormone is cortisol. I did know that. And it's one of the main molecules released during human stress. I did know that. I mean, I knew it was found in plasma, and I knew that, once again, you can't go through a day without seeing something saying reduce your cortisol, you'll probably lose some weight. It's a sign of stress. We're in a stressful society and stress is elevated, blah, blah, blah. Cortisol is involved with that. What I did not know was that the fluid around those pockets and around the teeth actually releases cortisol. I had no idea. This is a big deal because of the next statement. That cortisol significantly increased the Porphyromonas gingivalis, or PG, growth.
A sip of tea, and then reset the sympathetic tone through the night of the increased cortisol level related to circadian rhythm, and not only relaxes you, but stretches the autonomic nervous system to, switches the autonomic nervous system to parasympathetic tone, increasing the vagal tone. The only way to relax therapeutically is meditation, and meditation on the unconditional love of Christ through His passion is what you need to practice. Do not practice yoga or other New Age meditation. It is self-centered, it is based on pride, and pride is the love of the devil. You want to become a saint, you want to be healthy, both mind, body, and soul. Fasting, diet, stay away from sugar, meditate on this unconditional love through His passion, not the yoga, because it will give you no peace. It is an empty promise, those kind of meditation. Then we take care of the bacteria, the probiome. Feed them with a proper diet of prebiotics, which is essentially fiber, vegetables, cruciferous vegetables. So this is for now. There's a hope. In the next video, we are going to demonstrate on how to ferment, actual fermentation. I'm going to present it to you. Put a feedback and give me questions, raise questions so that we can discuss. This is Dr. Enad from Cadenza Medical Clinic, where medicine and faith converges. Thank you for paying attention.